So the anesthesia residency at the University of Oklahoma is unique in that we are literally the oldest academic anesthesiology department, independent of the Department of Surgery anywhere in the country.
And so our residents are going to get a lot of experiences through a lot of different key areas that are very important to train a good anesthesiologist. So residents are going to be very adept at taking care of people who are critically injured or critically ill and providing life-saving care for them.
OU is the only allopathic residency program for the state, and we are on campus with the only level 1 trauma center as well. And so our residents get exposure to high acuity, complex cases, caring for the most vulnerable patients for the entirety of the state.
When I was looking at residencies, I was really looking for a place that I could sense a decent amount of camaraderie among the residents and the faculty. I also wanted to look for a program where I felt I was going to be able to perform a wide variety of cases, specifically with this being a level 1 trauma center, as well as us having outpatient surgery, us having a VA hospital. We're doing a wide variety of cases, and I felt like I could get a decent amount of experience by going to residency here at OU.
I was interested in OU because I knew I wanted to be closer to my family. I loved Houston, but I was 10 hours away, so I knew I wanted to move closer. And so I came and I did an away rotation here, and I was here for a month, and I loved it. Everyone was so nice and so supportive. I never felt like I was an odd visiting student or anything. And I just saw the breadth of pathology and training that they had here, and it just felt like a perfect match for me.
So going to medical school and residency here, I've had the privilege of being here for the last 8 years. So I got to see the program firsthand as a medical student. And the things that really stood out to me are the general happiness of all the attendings and the residents whenever I was rotating through. And I just really enjoyed the whole culture of the program.
So the highlights of our program are that we get really early experiences with some big cases, specifically heart cases like coronary artery bypass grafts and liver transplants. And I'm a PGY2 resident, which means that I'm a second-year resident. We have a 4-year anesthesia residency program here at OU. So the fact that I'm able to get that experience now just helps me mature into the anesthesiologist that I want to be going into my 3rd and 4th year.
So I think that OU has a really great clinical experience. Starting out with our intern year, it's a very procedural heavy intern year where we get to do a lot of central lines and arterial lines and intubations. Moving on to the CA years, I think that the transition from intern to CA1 is really great. The anesthesia boot camp is where you really learn how to take care of patients in the OR, and I think that they do a great job of easing us into that role.
So as an intern, we've already had really hands-on, in-depth clinical experience. At Baptist, we rotate with cardiology, nephrology, we rotate through 2 ICUs, and then we also are the house officer during the day and night, and so we respond to codes and rapid responses throughout the hospital. And we place a lot of central lines and arterial lines, which are procedures that most interns around the country don't really get to do. And so the first year is very hands-on, and then that prepares us well for when we move to the ORs, because we have that procedural experience. We can focus more on medicine because we already know how to use our hands really well.
So I think what makes my residency a little unique is I've had a lot of life changes happen over the past 4 years. I got married and I've had 2 kids all during residency, and I think that our program in general has been extremely supportive in all those processes.
I think the biggest example of support that the residency has given me is that I'm a woman in medicine. I'm actually having a baby during residency. And so that's something that's, in the past used to be really taboo, and some programs still is kind of taboo and not supported. But, from day one, I've never had any kind of pushback or any kind of negative comments. Everyone's bent over backwards to help me and be supportive of my leave and everything. I just think that's so valuable, especially as a woman in a male-dominated field.
I came into medical school not really sure of what I wanted to do. In fact, I probably was leaning more towards a primary care specialty. And it was the mentorship within the anesthesiology department that drew me to really explore more about the specialty.
What we're looking for in our residents is people who are very much interested in the field of anesthesia, come in with accolades for their scholastic achievements, showing a well-rounded development through medical school, and even years prior to that, showing an interest in research subjects as well as want to be outstanding clinicians. We train triple threats that can go after residency with us and equally be comfortable doing private practice, going into a fellowship of their choice, or in fact, staying on in academic institutions and being future teachers.
So if you're applying to residency right now, whether you want to be here at OU or not, I encourage you to really look at the program specifically with the people, because those are the people that you're going to be around every day, especially in the OR with the environment of workers that we have with our circulating nurses and our other residents and other specialties, as well as your staff. Those are the people that you're going to surround yourself with every day. So I really encourage you to look at the people. Also look at the educational opportunities offered by your program. So all in all, if you're applying for residency and you're nervous, that's okay. You're supposed to be nervous. You're gonna do great, stay confident, and you can get here if you have the perseverance and the attitude to be here.